Hello and welcome to another episode of Walking with Walfinch. I am extremely excited today to introduce my very esteemed guest, Professor Martin Green, the CEO of Care England. Welcome, Martin.
Thank you, Amrit.
Pleasure to have you on the show.
Great to be here, and what a wonderful, different way to do an interview.
Well, great outdoors and keeping it
Exactly.
creative. You know, it's. I always find you have a better conversation on a walkabout rather than having a notepad in front of you.
No, I agree. This is a first for me, but I'm very interested to see how it goes.
So, Martin, can you please start with telling us what is Care England?
Well, we're a representative body for care providers, and we have a lot of services which support older people, a lot of services for people with learning disabilities and autism. We have some brain injury services and some mental health services. We cross over both the commercial sector and the charitable sector. So I think we have quite a good understanding of what the big issues are in social care, and we hope to not only provide a service that gives our members information and lobbies with government, but also increasingly we've got a really clear range of ways in which our members can save money. So our offer to members is not only how we're going to position social care with government, with the media, with opposition parties, but it's also about saying we want you to have the benefits of membership, which will absolutely be in your bottom line. And that's been our strategy over the last few years.
That's very interesting, Martin. So you've been with Care England for almost 20 years now.
Yeah, exactly. I can hardly believe it. But do you know, one of the things that I think is quite amazing, Amrit, is in those 20 years, I don't think one day has been the same as the last or the next. And I think that's what keeps me energized and why I really enjoy this role.
It certainly sounds like social care, doesn't it? So,
Well, exactly.
So what got you into social care in the first place?
Well, I mean, I did, when I left school, I went to university in Newcastle and I did sociology and research. And of course, the sociology particularly led me to discussions about things like inequalities. I was particularly interested in the issues around older people. And I think when I was doing that, which was decades ago, it was something that really wasn't on the agenda. So from that, I then started to get interested in the whole issue of social care, social work, social policy. And that really was what has defined my career.
That's very interesting. And how did you fall into Care England in the first place?
Well, I mean, I had a long trajectory to get to that point. And I started life working actually with children for a charity called Gingerbread, which was a single parents charity. And I did that for about a year and a half. And then I got a role in a housing department where I was doing work on housing benefits. And there I was seeing issues around older people whose pensions were not, meeting their needs, housing issues. So I did a lot of work on older people in the housing department. Then I got a job at Age Concern Greenwich and became CEO at Age Concern Greenwich at the age of 26.
Wow.
So I then was on a trajectory around issues around ageing. And I later became a trustee of Age Concern England, which was the national body. I then went on to do work in a research charity doing work on aphasia, which affects a lot of older people because of strokes. I then had a time in Uganda where I worked on HIV/AIDS programs, and that was really interesting. An interesting dynamic there was a lot of older people were looking after younger people who had had their parents die of HIV-related conditions, and also the children themselves who had HIV. I came back, went back into the Age Concern Federation, and then I was lucky enough to get the job at Care England. So it's been a really interesting and fun career.
Gosh, I mean, and what a varied career as well. It's
Yeah.
I think that's really interesting. If I think about the lobbyists that we've got in this country in our space, in social care space, you are right there and always at the forefront, always kind of driving the activity forward, lobbying the government. I think that's such an important role that actually very few people have been effective in filling. And I think to be effective for that length of time and be relevant for that length of time is really something to be commended. So I thank you from the whole sector.
Well, that's really nice of you to say, Emmerich, but of course, really it's for my members to judge. And unfortunately, we put a lot of energy into lobbying, but social care is still in a place which I would not want it to be. There is so much more to do. And that's why I think our approach to lobbying has to be about saying, we will offer the government solutions. There are any amount of people who tell them the problem, and we need to do that as well. But we need to say, you need to do things differently. This is what you need to do. So our approach to lobbying is to be very focused, very solution orientated, and very collaborative with government at local and national level.
So one of the things I was thinking about on the train here this morning was at Walfinch we talk about thriving, and we talk about aging well. And so not just surviving in your older age, but actually thriving in your older age. And to that, I have actually become recently the ambassador for the Royal Osteoporosis Society. And I think it's such an interesting synergy between the two worlds of osteoporosis, aging, sustainability.
Yeah, I absolutely agree. And, osteoporosis is something that our sector needs to engage with, not least because lots of people who are in care services have osteoporosis. But actually, if you look at the osteoporosis trajectory, a lot of women, particularly women in their 50s, have osteoporosis. And of course, they are the mainstay of our workforce. So this is something we've got to engage with, not only because of the issues around the people we support, but also because of our own workforce.
And it's so true, isn't it? I mean, so if you were lobbying the public, what would you say to them? What would your message be to talk about how aging could change within the UK?
Well, I think one of the things we've got to do is get people out of denial. So the problem we have is we're in a society where everything is focused on being young. So if you look at the images in advertising, if you look at how people perceive older age, it's usually in a deficit model. They think of older age in terms of what they can't do rather than what they can do. Now, actually, we should start making it much more about people thinking about what sort of older age they would like, and then thinking about what do I need to do to make sure I have that older age and have a good life. And I think there are lots of things people can do, but I think the challenge is people are in denial.
Yeah.
And I know as somebody who's aging very fast myself, you don't really want to confront the planning you have to do to think about the future. So, for example, so many people leave moving house until it's too late, until they've fallen downstairs, until they can't manage the garden or whatever. But trying to get people to make decisions early and to plan for the future, and also to understand how free they might make themselves if they do make informed choices at the right point.
Yeah.
I have to say, this is something, we worked on so much at Age Concern during my time there, but we still didn't manage to get people to connect with the issue. And it is really difficult because of the negative perception of aging.
And that's the thing, isn't it? It's that negative perception of aging. I find that within home care, social care, which is one of the reasons I've sort of taken to social media and doing things like this, because actually, well, why can't home care be sexier as a business and be more interesting for younger people,
I couldn't agree more. And I think one of the issues is we have got a real problem with the way in which both home care and residential care are commissioned. Because what happens is people are supported at the point when they've gone into crisis.
Yes.
We need to roll back and we need to start thinking about how home care, for example, can be used preventatively. And if you use home care effectively, and also, I am so irritated, and Jane Townsend is very, very eloquent on this, by the way in which home care is commissioned. It's always commissioned on process and time and money rather than outcomes. And if we could give people the scope to work with the people they support in creative ways, we would be able to use home care as a really preventative element of the system. Similarly with residential care, if people made informed choices earlier, they would get much more benefit out of being in a residential setting.
It's very interesting you say that. When I talk to our franchise network, I often talk about how our tilt is always towards private work. And the reason for that is that we can get into the journey much earlier. So with a local authority package, it is purchased at time of crisis.
Yeah.
Whereas if you're purchasing care privately, you're thinking, well, okay, well, actually, Holden Dad's starting to be a little bit forgetful. Why don't we start with a bit of cleaning in the kitchen once a week for an hour?
Yeah.
And it just builds 2 years before things get to crisis point.
No, exactly. And of course, if somebody's getting forgetful, often it's because they're isolated.
Yeah.
If you inject somebody coming in and doing the cleaning, but also asking them about, what holidays did you used to go on with your family? Have you seen this friend or that friend? Or, if you don't want me to do the cleaning next week, I can take you, if you like, to the gallery around the corner.
Yes, yeah, exactly that.
So it's about being much more flexible in how we use support.
It's so interesting. I mean, we talk a lot about cognitive engagement, and that's really what you're saying here. And one of the other things that we've really started focusing on a lot is that physical activity as well, because people like Dr. Peter Attia talks a lot about longevity and muscle mass,
absolutely.
saying, well, okay, actually, if we were increasing our muscle mass in our thighs over here, things like osteoporosis will be put at bay, but also your falls will reduce.
Absolutely. And there are so many simple things which also, home care services are brilliant at helping people to do things like a bit of chair yoga or stepping out or, sitting with them in the garden and saying, let's walk round the rose bush, whatever. And we've got to make sure that people remain as active as possible.
Yeah. And that is exactly it. I think, really making activity a focal point is I think, really key. So all of that being said, just moving slightly onto your forte of the government.
Yeah.
If you were, we talk a lot about there's not enough money in the sector and so on, but if you had one thing that policymakers would actually listen to, that would be the golden ticket. It would change things for the right. What would that be?
Well, I think it would be about saying, let's stop having this artificial difference between health and social care. Let's use the global budget, which is now at, about 270 billion pounds. Now, these are astronomical sums, but one of the problems is we have got so much of it locked in the organisation called the NHS, and we need to shift the dial, and we need to stop thinking organisation and process and start thinking about people and outcomes. Now, I'm convinced if we had that global budget and we apportioned it for people and outcomes, and we co-produce things with people who use services, I think we could have both good quality health and care services, but I also think we might be able to remit money back to the Chancellor.
Yeah.
So I think the issue for me is this absolutely ridiculous artificial separation, which is a symptom of a 1948 decision. But we're now in 2025, and the system hasn't modernised and doesn't realise people live different lives now to how they lived then.
Well, and I suppose this is exactly it. I was talking recently with some friends about this and saying how when the NHS was developed, it's a wonderful system, but when it was developed for people on the poverty line that could barely buy bread, and the population size was significantly low. It's a post-war policy, essentially.
Yeah, no, absolutely. I couldn't agree more. And one of the things that also happened was, at the time when it was founded, in the NHS, you were either diagnosed, they then treated you, and you came out either cured or dead. The challenge of the 21st century is long-term conditions, and we have got to get to a point where we understand that the system needs to support people to live well with things they can't cure.
Yes, well, exactly. And so how much of that 260 billion is going towards the NHS, and how much of it is going into...
About 230 billion goes to the NHS. And in fact, the NHS increase, which was about an extra 30 billion, was more than the global spend in England on social care.
Which is madness.
Madness, absolute madness. And the other thing that really annoys me is the ICBs have been beyond useless.
Yeah.
They were supposed to be delivering integration. I'll have to say, I'm so old, I've been through this movie so many times. PCTs, CCGs, health and wellbeing boards, they're all going to deliver integration. None of them did.
Yeah.
So there needs to be a radical culture and structure change.
And so what would that look like? If
Well-
you were creating that structural change, what would you do?
Well, I would first of all make sure that there was a continuous and unified assessment process, which would assess people for both health and social care needs. Then I would have budgets, and I would try to allocate individual budgets and make people work to those budgets in collaboration with the person or the people who love them, defining what's most important to them. Interestingly, and I saw this when I did some work many years ago in Lambeth, I reviewed really high cost care packages and nobody wanted them.
Yeah.
What they wanted was lower cost stuff that made a difference.
Yes. Yeah.
So I think we've got to really...
It's a practicality of it. I think this is where it's disjointed, because you have, people in government that are making sensible decisions, but they're not practical. And people on the ground want practical decisions, and often they're cheaper solutions and smaller things.
No, absolutely. And that was what I found when I did this review in Lambeth. And people were sometimes getting very expensive care packages. But they were saying to me, well, we don't need any of this.
Yeah.
I want to be able to go out and see my daughter. So I want somebody to be able to be with my husband who's living with dementia whilst I have some time to myself.
Yeah.
Now, none of that appeared in those care packages.
Yeah, well, exactly. I mean, and therein lies a problem. I often sort of laugh, frankly, because I think about the people that are advising the government have no idea about commerce, have no idea about social care. They are just people that are looking at it from theory.
Well, exactly. And of course, the other thing is, I've noticed over the years, we have governments who literally run countries via soundbite.
Yeah.
And this has happened with this government. We're going to have a national care service. Now, Andy Burnham first talked about that when he left government about 14 years ago. And they've had those years of opposition, but they've got no route map to delivery.
Yeah.
So I wonder what they do when they're in opposition. I would have thought that if you're in opposition, you'd be thinking about not only what your vision is, but how to deliver it. I would also say that this government knew for about 2.5 years, because they were reading the data, that they were likely to be in government.
Yes.
And of course, they got a big majority. So this gives them the real clear bandwidth to be able to say, now we will move forward and we will do something clear and strategic around our vision and the route map to delivery. But they've done none of that.
Well, and it comes down to a lack of planning. And often I think the NHS is a bargaining counter for winning votes, and nobody wants to mess around with it.
Yeah.
And this is, for me, where the issue is. I often think if the NHS was like the Bank of England and it was kept separate from, voters, essentially, that would mean that we can make some positive impact.
No, exactly. And of course, everybody goes through this obsession. The moment you say, I want to change something in the NHS, people say, oh, they're trying to privatise it. Well, I'm not bothered whether it's private, whether it's public, whether it's, community ownership. I just want it to be delivering what I need it to deliver. I want it to stop me going into crisis.
Yes.
So I want it to be about supporting low-level interventions so that I don't go into high-level need. I also want it to tell me what my responsibilities are. So I drink too much, I do all those things, not taking exercise, all that stuff. And I need to be told there might be a consequence, and then I need to be told what the consequences for me will be.
Yeah.
And they might be financial. And of course, we're seeing that to some degree with, for example, issues around weight and surgery.
Yes.
And people being told, well, we won't do surgery unless you've lost weight. So I think, we've got to have a much more adult conversation about what we want from this system, what we're prepared to pay. Of course, my view as well, it's really interesting how everybody talks about the cost of social care. There are some things the government spend money on. Nobody ever says, well, they're ridiculously expensive. Let's stop spending there and start spending here.
Yeah.
So, I think of things like the public sector pension burden that the rest of us carry. We don't ever, in our real world, anybody who's not in the public sector would never be able to attain the pensions that many people in the public sector have. But why should we be paying for that? If we're being told it's about money purchase and we have to make provision for our retirement, why aren't they being told that?
It's interesting. There was an Economist article talking about the pension system in the UK being more like a Ponzi scheme, and you're so right in likening those two things. So where in the world is there a system that works
Well, I mean, I think you can
or
point.
works enough?
Yeah,
Right?
well, I mean, you can point to places, for example, like Norway. But of course, Norway has a very small population. And interestingly, one of the things that Norway did when it got its North Sea oil, they didn't spend the money as they got it. They created a sovereign wealth fund. And that sovereign wealth fund is one of the biggest in the world. I think it now is the second biggest in the world. So what they have is created a situation where they churn money so that you can have a Rolls-Royce services, but you don't necessarily have to be paying for them as you go. But of course, the issue there, and the issue for us, which nobody ever engages with, is the issue about overpopulation. And if you've got too many people, and also the levels of dependency versus those who are in work, mean that it is incredibly difficult then to be able to sustain public services. And what we're seeing now is the quality of public services is going down. Yeah. And you know, there are improvements in the NHS, but you know, ask anybody about the refuse collection, about their roads, about their street lighting, about all the things that are being heaped on them, and also how many times we are being taxed. Yeah. So, you know, you've got your income tax, you've got your VAT, you've got your council tax, you've got your fuel tax, you've got your road tax, you've got your congestion charge, you've got your ULEZ charge. How many times can they screw money at you and not deliver? So, you know, I think people are getting more and more fed up with that. So I think we have to have a bit of a reset on what we want as a society, what our priorities are. And also, you know, the other thing that I think is really interesting, everybody talks about commissioning new services. Well, I wouldn't let anybody commission anything new until they told me what they were going to decommission and take out. Because it was said to me once by a former chancellor, when I said to him, I can save the NHS 12 million. The Chancellor said to me, well, you can save 12 million if you stop spending 12 million in other areas. And he said, my problem is everybody beats the path to my door telling me what they can save, but nobody tells me what I need to stop spending in order to make that real saving.
And this is really interesting because here we're talking about how structural change in the NHS would be where we claw back some of that money, put it into social care, change the way we commission social care and start a much more preventative service much earlier, which long-term impact would be tremendous. Exactly. But the problem is that we're only thinking in 4-year segments.
No, well, exactly, and that's another thing. You know, everybody thinks in a political cycle. Well, these require long-term strategic decision-making. And it goes back to what you said earlier, Amrit. I think there is an argument to take this out of political control, just as the Bank of England was taken out of political control. Yeah. But of course, when you do that, politicians on some levels don't like it. And that's what we saw with the abolition of NHS England, which was the Secretary of State did not like the fact that he didn't have command and control over the NHS. And on some levels, if I was behind his desk, I'd be in exactly the same space. But I hope that this is the moment for a radical reset, but I don't think it will be, because I think what we'll see is the next 4 years completely subsumed by everybody wondering about which job they'll have, where they'll be sitting in their office, loads of money, which of course has not been budgeted for, on redundancy payments, loads of people who will be made redundant, given lots of money and then brought back later. So these are the challenges. They're the challenges that the public sector perennially goes through, but they're also something that government should be recognising as a repeating pattern and doing something about. So I would never have said, I'm going to abolish NHS England before I had the roadmap on how I was going to do it, how I was going to pay for it, what the long-term benefits would be. For example, nobody has told me what the key milestones in this process are going to be. Nobody has told me what the timelines are. Now, if I was in a business and I was doing a complete massive reorganisation, I would have to have detailed plans about outcome measures, timelines, cost implications, you know, whether or not I had to invest to save. All that would be part of the plan. But none of it seems to be part of this plan.
Well, and this is it. It's just constant decision-making without forward thinking.
Well, exactly. And it's constant decision-making, but with no route map to how will I make a decision work.
Yeah.
And that's the issue.
And so going right down to a micro level, as if you were a home care franchise or a care home, nursing home,
Yeah.
and you thought, well, okay, here is the political situation,
Yeah.
and here is the public fund, the private pay. I'm also trying to create a, culture-focused values business. How would you start that business? What would you do differently?
Well, the first thing I would do, I would survey the horizon and I would say, right, where are the gaps in provision in this area? So I would not say I'm going to have a home care business which does what everybody else does. I would say, what are the gaps? Where can I fill them? How can I look to get external different funding bases? So, for example, could I get people on direct payments? Could I be offering a suite of different services that might be about low-level information, advice, support? How would I get people to recognise the benefit of it and pay for it? How would I make sure that my offer to staff was more attractive than my competitors? What would I do about flexible working? How would I build a cohort of people who are values driven and values based? I would be thinking those sorts of questions rather than I'm just going to start a new home care business.
Yeah. And I think this is really interesting because I often talk about when you're starting any business, really, you're starting a marketing funnel, essentially. And what you're trying to do is not do what your competitor does really well. You're trying to see what are they totally crap at.
Yeah,
and I'm going to double down on that.
Yeah, exactly. And also, I think we need to think about how we, both in home care and residential care, start to change the model to be fit for purpose in 2025.
Yeah.
And I have made myself a bit unpopular in some quarters by saying I think lazy commissioning by local authorities is driving lazy provision.
Yeah.
And we need to be thinking about what we are doing, what the outcomes and benefits are, how the business can be sustainable, how it has the potential to grow, what the impact will be on growth and development of staff, how can we ensure that staff are both valued, rewarded, trained, and then from that, and we see from the skills for care data, that means they'll be retained.
Yes.
And that will be good for businesses. Retaining staff is so much better, not only for the quality and continuity of care, but also for the bottom line of any business. So I think those are the areas that I would focus on.
Now, that is really interesting. And so before I get to my final question, Martin, if you look at the 10-year horizon in the UK market here as for social care providers across the network, what does it look like?
Well, I think it'll be a lot of shakedown. We'll see a lot of smaller providers going out of business. We'll see a lot of consolidation because only economies of scale can work in this sector. I think we'll see greater advent of franchising in residential as opposed to it being mainly about home care because you need those economies of scale in order to be able to survive in this very tight financial position. I think what we'll also see is, I suppose, more flexible and multifaceted services that are providing not only the high-level care, but also the support narrative that keeps people well. So I think there's a big shakedown going to start happening.
That's very interesting. And my final question to you, Martin, is if there was one message that you could plaster on a billboard for every care provider in the UK to see, what would it be?
Don't expect the government to come up with a solution. They never have, they never will. We've got to drive our own agenda. We've got to deliver our own future.
Absolutely. Thank you very much, Martin.
Thank you, Ambrose.
What a pleasure.
Thank you.
And thank you for tuning in to another episode of Walking with Walfinch. Until next time.